It's been really interesting today to hear about all of these efforts to improve cancer care delivery and payment. We know that prevention efforts are still key to reducing cancer risk and the economic toll on patients, as well as federal, state, and local budgets. And we wanted to include today a discussion of state policy progress in reducing cancer. And we're now joined by David Woodmansee, Associate Director, State and Local Campaigns for the American Cancer Society's Cancer Action Network, along with Betsy James, the Senior Manager on the State and Local Campaigns team, also at the American Cancer Society Cancer Action Network, and I will turn it over to them.
Thank you so much for allowing us a few minutes on your agenda this afternoon. We are going to talk specifically about a document that we've published for the last 15 years called How Do You Measure Up? Betsy and I work on the state and local campaigns team, and we are split into two portfolios. One is the Access to Care team, which I head up, and that has to do everything with anything that any sort of screening or any sort of when cancer patients have cancer and they're undergoing their treatment, any insurance issues, any access issues, network adequacy, quality of life issues, all the issues that cancer patients and their caregivers go through. And then we have a prevention portfolio, which Betsy is part of that team. And, the real goal of that team is to make sure that my team doesn't have a whole lot of people to worry about. But unfortunately, in the cancer world, we do have a lot of people that have cancer and are quote-unquote cancer survivors that are still battling the disease. So what we try to do is in this document, as I mentioned, this is the 15th year we've done this, we try to measure some of our organizational priorities around access and prevention. And this is a legislative snapshot year to year of the policies that are in place in a given state. There's also regulatory work. We do not measure that in this document, but this is a document that measures our legislative work on many priorities. It's a 57-page document. It is policy-centric, but we go out of our way to try to make it user-friendly and tell the patient stories, tell the survivor stories, and point out some creative and clever wins on the state level. To get into a little more detail on that report, I'm joined by Betsy James, and she's going to take it from here. So, Betsy.
Thank you, Dave. Thanks, everyone, for your time today. I'll just begin by saying that you can access this report on our website. It's acscan.org/measure, and you can certainly reach out to me for hard copies should you need those as well. I'm so glad for the intro because we have been talking a lot about access, and I'm glad to talk a little bit about prevention as well because we know that about 1,650 people die in the United States every year from cancer, and roughly half of those could be prevented with if people could quit tobacco use, if they could exercise regularly, if they could eat a healthy diet, and get their recommended screenings. And so what we're going to see here in this report is how those policies can make those changes that we would all love to see. The way the report works is through a red, yellow, green rating system, and so if a policy is either non-existent or poor, we give it a red. If it's approaching the goal, we give it a yellow, and if it's a benchmark that's an evidence-based policy, it's effective, it's what we would recommend, then it gets a green. So that said, we have a lot of work to do. Only Massachusetts has reached 6 of the 9 benchmarks that we measure, and California reached 7 of the 9 benchmarks, but those are the only states that even come close to reaching all 9 greens. And in fact, the report found that about 20 states reached green in only 1 or 2 areas. So we have a lot of potential, but we also have come a long way since this report started. And just as an example, our smoke-free map, when we started this report, we had 2 green states, and now we have 25. So thanks to all the work of our advocates and our partners, we've come a long way, but we're here to show you today that we've got a long way to go. So I'm just going to go back here to the tobacco tax slide. So our cigarette tax is currently at $1.71 per pack on a national average, and that just recently changed. So Delaware, Rhode Island, and California all passed or implemented or did implement taxes in the 2017 year that just went into effect September 1st. So that national average is brand new. And as you can see on the map, we kind of have a mixed bag in this area. We've got several green states. We've got a mix of yellow and red. And you can kind of see some patterns as I go through these maps that we've got some shared goals in certain regions. So next I'll show you the smoke-free map. And on this map, unfortunately, we did not get anyone to green in the last year. Smoke-free progress has somewhat stalled. But the good news is that local progress continues. So 70 local communities passed the smoke-free law this year. So our work is certainly not over in this area, and we hope to see some statewide bills pass. And we certainly have states that are organizing and planning to pass those laws in the near future. Our next slide here is just a snapshot of our work when it comes to healthy eating and active living. As I mentioned, that's a big part of cancer prevention, and we think that about 20% of cancer cases can be attributed to unhealthy eating, inactivity, and excess alcohol consumption. So here's a snapshot of the policies in that area. There's too many to put on a map, but what we kind of want to demonstrate in the report is that it's not going to just be one silver bullet policy when it comes to our obesity epidemic. It's going to take many policies working together in the activity space and the nutrition space to really build some synergy and really tackle this, like I said, what I called it and what everyone's calling it, an obesity epidemic. And we're just transitioning here to our tanning slide. This is a law that we've worked on in many states to prohibit minors from using tanning devices, and we use the age 18 as the rule there. And this year, Oklahoma and West Virginia passed tanning laws, and so that makes 15 states. And as you can see, this state or this map does not necessarily flow with other regional maps or what we might think of as like red state, blue state maps. There's really some great activity happening in here in some unexpected places, and so we're really excited to see that some folks might have thought that a tanning law was a non-starter in a place like Texas, but they were actually one of the first. So we're really glad to see progress in that area. So again, kind of like our healthy eating, active living agenda, our access to care portfolio is very broad, and we have almost too many issues to mention in a map, but we do want to, explain to readers and to legislators that we have a lot of new emerging issues and a lot of great solutions that can be put into place to help cancer patients and potential cancer patients. So what we did here is we put some infographics in place that kind of talk about network adequacy, surprise billing, various other issues, and then we also link, we do a list of certain policies that we approve and that will work, and then we link to state bills that we thought the language was good. So this, like I say, kind of takes a different approach, but does give legislators an idea of the kind of work that we want to see when it comes to access to care. And Dave, did you want to add anything on that?
Thanks, Betsy. Just that obviously with cancer care, there are certain doctors that need to be in a network for cancer patients to be able to access, depending on their type of cancer. And there has to be some sort of geographic sense to how far people have to travel to see specialized to see specialized care for their cancer. So those are some of the type of things that that we are paying attention to, and the telemedicine also telehealth is something that's relatively new on the horizon, and that we're looking at how we can help make that a reality for people where that it makes sense for. Obviously, telemedicine is not going to be adequate in certain instances. So we have to have some sort of common sense in our policies around that. We are getting up to speed on that, but that is an emerging issue that for us, anyways, that Betsy was referencing.
Thanks, Dave. So our next map is measures which states have expanded Medicaid and which have not. So we're up to 32 states, and this is really a core policy for us. I mean, it's at the root of what we do, getting our cancer patients access to care. And we've done a lot of research explaining that without access to care, people are less likely to get screened. They are more likely to be diagnosed later when cancer is harder to treat. So there are all sorts of reasons that our constituency needs good access to care. And like I say, this is one of our absolute just core issues that we focus a lot of time and energy on.
Yeah, and besides expansion, I'll just add, we are spending a lot of time in the last year or so, 8 months, trying to protect Medicaid in the states. It is an important safety net program for a lot of working poor, and a lot of people don't know, although some of the people on the phone will probably know because you're professionals in this area, but 1/3 of all pediatric cancer patients are in the Medicaid program, are treated through the Medicaid program. So a lot of people don't realize that, 1/3 of the it's almost 1/3, it's 31% to be exact. But a lot of children fighting cancer, dealing with cancer, are in the Medicaid program, the traditional Medicaid program. So that's a very important program for us to protect.
Our next slide measures pain policy in the United States, and this is based on the Pain Policy Studies Group survey at the University of Wisconsin. So as you can see, again, we've got a lot of states in yellow, we've got few in green, a couple states even in red, and Dave has worked hard to help states really craft language and find that balance when it comes to dealing with opioid crisis, but then also making sure that cancer patients have access to the care that they need. So Dave, I'll let you say a word about that too.
Yeah, that's exactly right, Betsy. I do spend a lot of my time working with our folks on the ground in the state, and we are fortunate. We have people on the ground in every state capital. We have a dedicated staff lobbyist, and then we have a grassroots director. But I spend a lot of time helping our folks try to craft policies that are balanced. There's no denying every state in this country there's a terrible crisis with abuse and diversion of opioids, and we need to address that. But while we're addressing that, we need to remember that millions of cancer patients and cancer survivors are, have legitimate needs and use the way they're supposed to be used, opioids, to get through their day or their night with some decent level of quality of life. And, we've seen the pendulum swing, especially with the CDC's guidelines that were published in January of 2016, where some state lawmakers and regulators rushed to create legislation or regulation proposals that would make the CDC's voluntary guidelines law, and law for all docs, not just for primary care docs, which those voluntary guidelines were intended for. And the CDC voluntary guidelines clearly stated that it was not to pertain to cancer care. But in the states, that has become the norm in several places. So we spend a lot of our time trying to talk to legislators and policymakers about the need to have balanced pain policies where people that legitimately need those meds can access them, but people who, would abuse or divert them are prohibited from getting them. And prescription drug monitoring programs, have been a wonderful tool that is relatively new in the last decade to help with that. And every state in the country now has a PD prescription drug monitoring program in place, except for Missouri. The jury is still out on that one. The governor has proposed an executive order, but there's some problems with that about how effective it will be the way it is currently constructed. But we are working on that, and we will continue to work on that.
Thanks. And with that, we'll go to our last map. Now, I should have mentioned I didn't put all 9 maps in here just because we have limited time and limited focus. But our last map in this presentation is on palliative care, which we've obviously talked a lot about on this webinar. And Dave in large part developed model palliative care legislation just a few short years ago, and it has been introduced and passed in 20 states now. So 20 states have palliative care councils. They have state-supported websites that give information about palliative care resources. And then all of the yellow states have introduced that legislation. So this is about almost half the country or over half the country either has a law or is working on a law to increase access to palliative care. So we're very proud of the quick progress we made in this area. And just even in the last year, we passed it in 7 states. So this is obviously a hot topic. And Dave, go ahead.
Yeah, I was just going to mention that, getting to 20 states in 4 years is we're pretty happy with that. But if you look at the map, and Betsy mentioned this for the tanning map, if you look at the map, these are not the traditional states that are green on our maps when you look at the entirety of our maps. And as a matter of fact, we've passed this legislation in 12 quote-unquote red states as opposed to 8 blue states, which really tells us that this is truly a bipartisan issue and that people understand what the benefits are of palliative care, not only for patients and survivors, but for caregivers and family members. And if done correctly, palliative care can save, can limit costs in some instances and improve outcomes. So it's truly a win-win situation. And it's not rocket science what we've proposed on the state level. There's so much good that's happening around the country and in the states in palliative care and palliative medicine. All we're doing on the state level is passing a way for people to coordinate what's happening, all the good things that are happening in a state, so that the awareness is raised and thus the utilization is raised, which brings us to an interesting issue that as awareness and utilization increases, we're going to need the medical professionals, the specialists in palliative care, and that's what our federal legislation aims to do, is create monies that the states can be given to the states for continuing education and for furthering education for those that want to make palliative medicine a specialty. So, we're really happy with what's going on the state level, and now we're working hard to get to the other 30 states, and we're also working hard at the federal level to try to make sure that, they're doing their part so that, the professionals that want to be specialized in palliative services can do just that. So we still have some work to do. We're making progress, but we at least have the needle pointed in the right direction, we believe.
Yes, and I'm glad Dave mentioned our synergy with our federal work and our state work, because next week we'll all be together in D.C. with over 700 of our volunteers lobbying Congress on cancer research dollars, which we spend a lot of time at the federal level doing with our volunteer forces. But we also do research advocacy at the state level. So, of course, we want cancer registries funded and cancer control programs funded. And then what we do in the report is highlight a few states that go above and beyond in their research programs, like in California and Florida and Texas. So, again, I encourage you to look at the report. It is online, acscan.org/measure. And as Dave mentioned earlier, also you'll find great stories about our volunteers, about where we were successful, where we came up short in different legislative campaigns. So there's a lot more to the report than just these maps. But thanks again for the opportunity to share, and I'd be happy to take questions at the end as well.